Alright, so the next skill I'm going to do is gait and balance assessment. So obviously for balance, I'm going to be a little more cautious. I'm assuming that my patient walked in and as she was walking into the clinic, I was looking at her gait, assuming she's pregnant, and gait and balance. And then when I go to do my balance assessment, I realize that she's good enough to be able to perform a balance assessment without a gait belt on. I could essentially put it higher if I needed to and really was concerned for it, but otherwise I don't want to put it on her abdomen and compress her baby at all or any vital organs or anything like that. So in this particular scenario, I'm not using a gait belt. But first thing I'm going to do is assess her gait. So I'm going to have her go ahead and just walk back and forth in this huge clinic I have here. Alright, so go ahead and I would also have a tech maybe if I was concerned about her balance, but she's fine. Go ahead and walk towards me. And turn around. And one more time. So I think the biggest thing I picked up on there is she does supinate a little bit more while she walks. She has decreased arm swing and trunk rotation, more trunk rotation, and that's about it. She has a narrow base of support when she walks, which is normal for females. I guess guys walk further out. Women sometimes tend to walk more in like a straight line-ish. So next thing we're going to do is a balance assessment. So we're going to do Romberg, and there's a lot of different variations, but the one we're going off of is the one out of McGee. So first what I want you to do is I want you to stand together with your feet touching. Good. And I just want you to stand there for 20 seconds. So I notice any deviations, any swaying that she's doing right now. She looks fine. So the next thing that I'm going to have her do is close her eyes. Now this is where I'd be noting if there's any noticeable difference between eyes open and eyes closed. So far, so good. It would be positive if there was a complete difference in balance here, and if she had to maybe use her arms to compensate or open her eyes real quick or go to grab onto something or sway excessively. And that is it for this skill.